Creating a positive dental experience while maintaining the highest levels of quality and care are top priority here at SmileMagic. Sometimes when working with children, the biggest challenge isn't performing the actual dental treatment, but working with the uncooperative patient that doesn't understand why or what needs to be done. Dentistry is one of those things that many people struggle with, adults and children alike.
Here at SmileMagic, when working with children, we utilize the American Academy of Pediatric Dentistry guidelines on behavior management. Behavior guidance is broken into two categories, basic and advanced. We always begin with basic techniques. Those guidelines include establishing age-appropriate communication with both verbal and nonverbal techniques, tell, show, do, positive reinforcement, distraction, and the use of nitrous oxide. Age-appropriate verbal and nonverbal communication will help establish an instant rapport with your patient and lay the foundation for a positive experience. Your initial communication will set the tone for the relationship with your patient. Acknowledge the patient first. When we initially enter the exam room, whoever is sitting in the dental chair gets the first hello. Watch the tone of your voice. Voice control is key. Think slow and low. Slow movements toward your patient help decrease anxiety. Bend or stoop to the level of your patient.
So what's your name?
Homer.
Your name's Homer? Nice to meet you. I'm Dr. Evans. So what are you doing here today? Did you come get your teeth looked at? Yeah? Okay.
Next, we will tell, show, do. Tell and show the patient what is going to happen.
Okay, there's my mirror, and I use him to look at your teeth. And there's my tooth counter. I use him to count. I go 1, 2, 3, okay? But first we're gonna play a little music, all right? Did you know your teeth can play music? Did you know that?
After you tell and show your patient what will happen, proceed exactly as explained. Move forward with confidence so that you are in control of the tempo and the environment. Any delay can increase existing anxiety.
Okay, here we go. We could play a tune on these guys. They sound good. All right, let's take a look back here. Oh man, these are some good looking teeth, buddy. All right, you got some new ones coming in. Okay, Homero, now that all your teeth look good, we're gonna clean them up real nice, okay? And to do that, we're gonna have Mr. Bumpy here, okay? Have you ever met Mr. Bumpy before? Have you met, no? Okay, he's a little bit bumpy, but he's real nice, and sometimes he tickles your teeth. Did you know that? Okay, let me show you how he works. We'll hold him like that, and he spins around like that. See that? And I just put that on your teeth. Let me show you. Oh, you want, here, let me see your finger. There you go. I'm gonna do that, just like that. Easy, huh? Easy, easy. So we're gonna do that with your teeth, and we're gonna get some toothpaste here, and then we're gonna start to clean your teeth off. See that? Easy as can be, huh? Is that tickling a little bit? Yeah? It looks like it's tickling.
Positive reinforcement provides a verbal reward for the desired behavior from your patient.
Good job, buddy. Easy as can be, huh? Okay, buddy. That looks great, Homero. You did awesome.
With some uncooperative patients, voice control can help gain the patient's attention, avert negative behavior, and establish proper adult-child roles.
Good job. No. Oh,
An even yet
down,
firm voice can help reestablish the desired behavior necessary for a positive experience and safe completion of treatment.
Hey, Jackson. Jackson, I need you to cooperate, buddy. Put your hands on your tummy, and you follow instruction. We're going to clean your teeth now. Keep your hands on your tummy and open your mouth. Okay? All right.
Distraction works well in addition to positive reinforcement. Distraction is when we divert the patient's attention away from what might be perceived as a negative procedure. Conversation is a good way to accomplish this.
Good job, buddy. Good job. Attaboy. That's what I'm talking about. Now we're going to get this done in no time. Do you like to play soccer or anything? Do you play some sports? Yeah? I'll bet you're pretty good. Now tell me when I say the right one. Are you a goalie or a forward? Do you know what position you play? Yeah? Do you score lots of goals? Yeah? And look at that. Now we're done. Very well done. Good job, bud. Good job.
All the way.
Very proud of you. All of these techniques will help you decrease anxiety and increase cooperation in your patient. Working fast and being efficient in all that you do will help ensure the desired experience. Remember to consistently focus on the positive. That is the most effective way to deliver quality treatment and a positive experience.
Together with the previous techniques, you may opt to use nitrous oxide. We at Smile Magic always have this option available. Besides relaxing your patient, nitrous oxide can help control discomfort and also reduces a child's gag reflex.
So to quickly review, the basic behavior management techniques are as follows: communication and voice control, tell, show, do, positive reinforcement, distraction, and nitrous oxide. Most patients will respond positively to the use of basic behavior management techniques. These really should form the foundation to any management activities provided by the dentist. With children for whom basic behavior guidance techniques have proven unsuccessful, there are advanced guidance techniques available. The advanced behavior guidance techniques commonly used are protective stabilization, sedation, and general anesthesia. We begin our advanced techniques with protective stabilization. So, what is it?
The AAPD defines protective stabilization as the restriction of a patient's freedom of movement in order to decrease the risk of injury while allowing safe completion of treatment. When necessary, we at Smile Magic do have the option to utilize protective stabilization to ensure our patient safety, but only based on patient need and after parents' informed consent. Smile Magic requires an informed consent be obtained prior to the utilization of protective stabilization with any patient.
The first of the advanced behavior guidance techniques is protective stabilization. The requirements that must be satisfied before using this technique include: all basic behavior guidance techniques have been exhausted, informed discussion and consent have been had with the parent or guardian, minimal effective stabilization should be used, and it is only initiated at the direction of the doctor. So to demonstrate for us today, I've got my son Jackson here. So Jackson, if you can go and climb up here. All right, good job, buddy. Okay. So when utilizing minimal effective stabilization, we're going to start with just the ankles and the wrists. Okay. And this will prevent him from maybe reaching up or grabbing for something that might injure him or the treating team during treatment. If this isn't quite enough, then we can always move forward with securing the midsection. And then lastly, we can do the shoulders, chest, and lateral stabilization of the head. And so essentially that is protective stabilization from head to toe.
The second option for advanced behavior management is sedation. The decision to use sedation is one that should be made cautiously.
If oral sedation is ineffective for your patient or not a viable option due to a health concern, then the next option, or the last option, would be general anesthesia. This can be accomplished by referring your patient to a pediatric specialist or someone who has hospital privileges. In that case, they can then take them to the hospital or surgical center where the procedures can be performed under general anesthesia. To recap the key points of Smile Magic's behavior management procedures, behavior guidance is broken into two categories: basic and advanced. Basic behavior management should always form the foundation. Those guidelines include establishing communication with both verbal and nonverbal techniques, tell, show, do, positive reinforcement, distraction, and the use of nitrous oxide. Move to the use of advanced behavior techniques if the basic guidelines are not providing the safe and positive environment necessary to provide the care that's needed. The advanced behavior guidance techniques commonly used include protective stabilization, sedation, and general anesthesia. Proper utilization of these techniques will provide a safe and positive dental experience for both you and your patient. By no means has this been a comprehensive discussion on behavior management, but a brief presentation on both the basic and advanced techniques approved and recommended by the American Academy of Pediatric Dentistry. Additional clarity should begin with a visit to the AAPD website and review of Guideline on Behavior Guidance for the Pediatric Dental Patient. For any additional information or questions on behavior management, you can contact me at cdo@smilemagicdentist.com.